Have you ever wondered why, despite all the known health risks, millions of people around the world still choose to smoke? It's a question that baffles many of us. In an age of advanced medical knowledge where the harmful effects of smoking are widely understood and broadcasted, it's difficult to comprehend why anyone would willingly light up a cigarette. This, my friends, is what we call the smoking paradox. This paradox is a stark contrast between what we know and what we do. On one hand, we have countless scientific studies and irrefutable evidence showing that smoking is harmful. It's linked to an array of health problems including heart disease, lung cancer, and stroke. The facts are clear, the warnings are loud, and yet the trend of smoking continues to persist across the globe. So why do people smoke? It's a question that seems straightforward, but the answer is far from simple. The reasons behind this paradox are multifaceted, complex, and deeply rooted in a combination of individual and societal factors. Some smoke to cope with stress or to fit in socially, while others might be influenced by a family history of smoking. For some, it begins as an act of rebellion during the turbulent teenage years, only to morph into a habit that's hard to break. The reasons are as diverse as the people who smoke, but understanding these reasons is crucial. It's only by unraveling the complexities behind this paradox that we can begin to address the global smoking epidemic. So, as we embark on this journey to understand the smoking paradox, remember that it's not about casting judgment or placing blame. It's about understanding, empathy, and finding ways to support those who are caught in the smoke-filled web of this paradox. And with that, let's delve deeper into the reasons behind this smoke-filled paradox. So, what draws people into the world of smoking? The answer is as complex as the swirls of smoke that dance away from a freshly lit cigarette. Humans are creatures of habit and curiosity, and sometimes it's this curiosity that leads us down the smoky path. Let's start with peer pressure, a force as subtle as it is powerful. Ever noticed how a group of friends at a party often have similar habits? That's peer pressure at work. Imagine being the lone non-smoker in a group. As the cigarettes pass around, you might feel left out, even judged. So you take that first puff, not because you want to, but because you want to fit in. Then there's stress relief. Life can be a roller coaster of highs and lows, and sometimes the lows seem to stretch on forever. In these moments, the promise of instant relief that a cigarette offers can be incredibly tempting. The deep inhale, the slow exhale. It's a ritual that gives the illusion of control, a semblance of peace amidst the chaos, not to forget the perceived cool factor. Let's be honest, we've all seen those movie scenes where the hero lights up a cigarette with an air of defiance, or the rebel girl with a cigarette dangling carelessly from her lips. These images create a powerful narrative that associates smoking with rebellion, independence, and glamour. But remember, these are just illusions. The reality of smoking is far from glamorous. It's an addiction that holds you captive, stealing your health breath by breath. It's a habit that plays on your vulnerabilities, exploiting your need for acceptance, relief, or a sense of control. However, the allure of smoking quickly fades away when we look at its impact on our health. The next time you feel the pull of the smoke, remember this: you are not alone in your struggle. And just as there are forces that lure you into smoking, there are stronger forces that can help you break free. But more on that later. For now, let's dive deeper into the dark side of smoking. Do you know what smoking actually does to your body? When you inhale that puff of smoke, it's not just the lungs that bear the brunt. The damage extends far beyond, reaching the very lifeblood, coursing through your veins, your heart, and even your brain. Every single puff is a step towards a potential health catastrophe. Let's start with the lungs, the immediate victims of the smoking onslaught. The smoke you inhale carries over 4,000 chemicals, including dozens that are known to cause cancer. These chemicals, over time, destroy your lung tissue, leading to chronic bronchitis, emphysema, and lung cancer. It's like setting a slow-burning fire inside your own body. Now picture this: your heart, relentlessly pumping blood to every corner of your body, suddenly forced to work harder with every puff you take. The chemicals in tobacco smoke increase your heart rate and tighten your blood vessels, making your heart work overtime. The result? An elevated risk of heart disease and heart attacks. But the damage doesn't stop there. Smoking also increases the risk of stroke by 2 to 4 times. The smoke you inhale thickens your blood and damages your blood vessels, making it more difficult for blood to reach your brain. This can lead to blood clots, stroke, and even death. And then there's cancer. Not just lung cancer, but cancer of the mouth, throat, esophagus, kidney, liver, stomach, and even the bladder. The chemicals in tobacco smoke mutate your DNA, causing cells to grow out of control and form tumors. It's a grim picture, but it's important to understand the reality. Smoking is the leading cause of preventable deaths worldwide. Every year, millions of lives are cut short because of smoking-related diseases. The damage smoking inflicts is extensive and in many cases irreversible. It's not just a personal choice, it's a decision that impacts your health and ultimately your life. It's not an easy habit to kick, but understanding the deadly consequences can be the first step towards a smoke-free life. But it's not just your health that smoking burns through, it's also your wallet. Let's take a moment to examine the financial implications of smoking. The cost of cigarettes alone can stagger you. In many parts of the world, a pack of cigarettes can cost anywhere from $5 to $15. If you're a pack-a-day smoker, that's a daily expense that adds up quickly. Over the course of a year, that's roughly between $1,800 and $5,400 spent solely on cigarettes. Now imagine what you could do with that money if it wasn't going up in smoke. A vacation trip, a new gadget, or simply saving for a rainy day. The possibilities are endless. Then there are the potential healthcare costs associated with smoking-related illnesses. These costs can be astronomical. Treatment for lung cancer, heart disease, and other smoking-related diseases can run into tens of thousands of dollars, even with insurance. And let's not forget the indirect costs such as missed work days, reduced productivity, and the impact on your quality of life. But here's the silver lining. Quitting smoking can lead to significant financial savings. The moment you put out that last cigarette, you start saving money. And the longer you stay smoke-free, the more you save. Not to mention the potential savings from averted healthcare costs in the future. Consider this. The money you save from not buying cigarettes can be put to better use. You could invest it, save it, or spend it on things that improve your life rather than harm it. So the next time you reach for a cigarette, think about the cost. Not just the price you pay at the counter, but the real cost. The cost to your health, your wallet, and ultimately, your life. So, the cost of smoking is twofold. It's a hit to both your health and your finances. So, how can you break free from the grip of smoking? Well, the journey to a smoke-free life isn't a one-size-fits-all. It's a path you carve for yourself, a personal endeavor that requires commitment, patience, and a dash of bravery. There are a myriad of strategies that have proven effective for many, and today we'll delve into a few of these. Let's start with nicotine replacement therapy, or NRT. This method involves substituting the nicotine in cigarettes with other nicotine products like patches, gums, or inhalers. The idea is that by gradually reducing the nicotine dose, you can wean yourself off it, making the withdrawal symptoms more manageable. Then there's counseling. Speaking to a professional can help you navigate the maze of emotions and challenges that come with quitting. They can provide you with tools and techniques to resist cravings, handle stress, and maintain your smoke-free status. Support groups can also be incredibly helpful. There's something empowering about being in a room, virtual or physical, with people who are going through the same journey. Sharing experiences, victories, and setbacks can provide a sense of camaraderie and encouragement that is often needed during this challenging time. And let's not forget the benefits of quitting, which are plentiful. Your health improves dramatically, from your heart to your lungs, your skin to your teeth. Your life expectancy increases, and your risk for numerous diseases drops significantly. There are also financial benefits. Think about how much money you spend on cigarettes. Now imagine that money in your savings account, or used for something that brings you joy and promotes your well-being. Quitting smoking doesn't just save your health, it saves your wallet too. Remember, it's never too late to quit. Every moment is a fresh start. So, take the leap, breathe freely, and embrace a smoke-free life. You owe it to yourself, to your loved ones, and to your future. It might not be easy, but it's definitely worth it.